Good afternoon and welcome to the Injury Prevention webinar. My name is Lisa Contreras and I am the Project Play Western New York coordinator and I will be your host today. Project Play Western New York is driven and funded by the Ralph C. Wilson Jr. Foundation, Youth Sports and Recreation Focus Area in partnership with the Community Foundation for Greater Buffalo and the Aspen Institute Sports and Society program. Project Play Western New York envisions a community in which all children have the opportunity to be active through sports regardless of the zip code. A few housekeeping items to begin. You may ask questions at any time through the Q&A feature at the bottom of your screen. Director of Project Play Western New York, Bridget Nyland, will moderate the questions and answer portion at the end of the webinar. Bridget also wants me to remind you of our youth sports survey that you can find on our resources page, and please fill it out if you have not done so already. And you can visit us at projectplaywesternnewyork.org. During these uncertain times, Project Play Western New York will continue to post information on our social media channels to help families and kids stay active and engaged through sports. Be sure to check us out on Facebook, Twitter, LinkedIn, and Instagram. But earlier this week, Section 6 Executive Director Tim Slade, a member of our advisory council, stated that athletic directors and principals earlier this week that leagues, if they were able to return back and have the ability to schedule regular season varsity games, that to allow them to return to school and practice requirements are met. But his main issue with it, which now we know, considering that schools will not be back in session for the rest of the year, that there will be a lot of injuries come from this if their student athletes were not in the right conditioning and practices. So, and then also ESPN earlier this week reported that a lot of coaches, athletic directors nationwide were thinking about the same issue and were really worried about all of their athletes coming back and having soft tissue injuries once their players resumed after this long break. So today we hope to address the concern around discussing ways in which athletes can use the stay-at-home period to work on key condition skills that help prevent injury. Dr. Les Bisson, MD, is a professor and chair of Orthopaedics Surgery at the State University at Buffalo School of Medicine. Dr. Bisson also serves as a team physician for the Buffalo Bills and Buffalo Sabres. We are fortunate to have his expertise as a member of our Train All Coaches working group. Dr. Bisson will now discuss how to decrease team injuries by following simple at-home exercises that do not require equipment.
Share here in a second, so we'll have some slides that we can go through, and let's get that going. So everybody should be able to see my slides right now. And I hope that you can hear me. If not, somebody let me know. But the topic of this conversation is what sport injuries can be prevented and how can I do it? So let's start with, who am I? I'm a sports medicine surgeon. That's the primary hat that I'm wearing when I'm delivering this talk. My career has been taking care of youth athletes, and I've done that for over 20 years now. I've done over 1,500 ACL reconstructions in that time, and we know that if an athlete sustains or suffers an ACL injury, we can return them to play pretty predictably, but they punch their ticket for a 4 to 6 times chance of increased arthritis as they go on through their life. So that's a problem. We also know there's great scientific evidence that approximately half of ACL tears can be prevented. The gap is that a lot of times the things that are being done or should be done to prevent ACL tears aren't being done. We also know that the most effective interventions in medicine are proactive rather than reactive. If you think about, well, we've got this coronavirus going on right now. We're taking proactive measures to lessen the spread of or the transmission of coronavirus. The best treatment for coronavirus right now is not to get it. So what are we doing to not get it? We're social distancing, we're sheltering in place, doing all these other things while we sort of wait and hope that we get better treatments and vaccines. But there's plenty of examples in medicine where the best treatments are to avoid the disease in the first place. And if we have things that can prevent the disease, we should use those. We have things that can prevent injury, disease. We also know that many youth sports teams don't have certified strength and conditioning coaches or trainers, and most coaches don't have actionable information in terms of how do they prevent these injuries. Who are you? Who are the people that are listening on this webinar? As of a couple days ago, we had 19 responses. I think when I just turned my Zoom on and started delivering the talk, there were about 45 participants. There's men and women that are listening. There's at least 2 certified strength and conditioning coaches, a physical therapist, and an athletic trainer. So we've got some experts in our audience, and we probably have a lot of very experienced people in our audience. 6 of 19 of the respondents coach sports, basketball being the most common, but a variety of other sports, most at the youth level, but I also understand there are going to be college coaches listening and listening in on this talk. And you can see the age groups that are represented. 13 of the 17 that answered the question about first aid know some first aid. 12 of 16 are CPR certified. There's a little bit more than half that have injury prevention training. And everyone was aware that answered this question. They're aware of injury prevention strategies. And it's a pretty good group in terms of their employment of them. 8 of 8 that answered the question about a structured warm-up do that before practices and games. Half of you roughly are recommending injury prevention exercises to your team. And the strategies that were most commonly employed are a warm-up, conditioning, and education of the athletes. I'm going to ask you to do something here real quick as we're going through this. And we can do it through the chat. You can do it on the chat poll. I'm just asking you to indicate with a 1 or more numbers than that, how many field sports like soccer, football, lacrosse, or field hockey each of you coach, or how many court teams, basketball, volleyball being the predominant ones that we can prevent ACL injuries in particular in, or how many coaches in those sports you influence if you're in an administrative role. So you can just put that into the chat. And Allison and Bridget can give me that information as we get a little bit deeper into the talk. But really what I want to know, and you know, there's nothing that we're going to do with this other than help to educate the audience, hopefully. But it is it's interesting to find that out, and I'll tell you why in just a second. So what's our vision? Why are we doing this? In some simple ways, we can make Western New York the safest place on the planet for youth sports participants. It's like Marv Levy says, it's simple, but it's not necessarily easy. And we're trying to close that information gap and give everybody actionable information that they can do to prevent youth sports injuries. And honestly, the people that are listening here, we're it, you're it, you have the tools to do it. So do we have any even preliminary information right now about how many field or sports teams are coached? Maybe Allison, you can unmute for a second and let me know if there's stuff coming up there. When I've given this talk before in person, I'll have people in the audience stand up if they take care of a youth or a sports. I'm sorry, if they are responsible for those. And you know what, maybe I can even look at the chat here for a second.
Yeah,
Okay,
it looks like an
good.
average of
Awesome.
about
So there's lots here, 2, 4, 8, 10, 15, 17, 19, 20, 21. So already just from that quick little poll, people are representing 21 different sports teams at a minimum. So if you're already doing this, awesome. If you're not doing this, then great, there's an opportunity. But that's the minimum number of significant injuries that you all could prevent by just doing some of the things that I'm going to show you here in this talk. And they're simple, and these are real people that you can prevent injuries in. ACLs we can cut by about 50%. And if you're a soccer coach, if you're a women's soccer coach, you know that on your team there's about one gal a year that's going to tear her ACL on that team. Sometimes it's 2 on each team. You can cut that in half by doing some simple preseason and before practice and game warm-up exercises. You can also prevent concussions. You can prevent high ankle sprains, low ankle sprains, muscle strains. So at a minimum, if you do these things, you'll prevent at least one significant injury per season per team. So injuries can be prevented, but it does take a team. The team that generally we would use would be administration, a coach, a parent, the players, and a trainer and strength coach. The problem is that most of the teams that you all coach, if you're at anything other than the collegiate level, most of your teams don't have an athletic trainer. Most of your teams don't have a certified strength and conditioning coach. What they really have is they have a coach, and a lot of you are the coaches, or a lot of you are sort of directing and providing information to the coaches. So if you're going to make Western New York the safest place on the planet for athletes to participate in sports, it really has to be done by the coaches. If you're administration, you can help the coaches to do the right thing. If you're a coach, you can do the right thing yourself. And again, it sounds like a lot of you are already doing the right thing. Here's an open secret. The injury prevention exercises and proper equipment that you would use to lessen the injury rate improve sports performance. So look at the list of things here and decide whether or not these are things that you would like your athletes on your team to have. Would you like them to have better balance? Would you like them to be faster, stronger, and more agile? The simple preseason and warm-up exercises that I'm going to show you, and these are scientifically validated. I have no skin in this game. As a matter of fact, like I said, I'm a sports medicine surgeon. So the only thing this is doing is lessening my business. I'm not paid or anything else for this. I'm just trying to help our community do the right thing. But these injury prevention activities and exercises that you would have your team do, train those things: balance, speed, strength, and agility. So what are the components of an injury prevention program? And what would we be doing in Western New York? How would that look if we were the best on the planet at preventing injuries? We would be thoughtful and intentional about the practice planning that we have and the rules that we have. And I'll tell you how those things, some small things that coaches and administrators can do, can make a huge difference. We'd incorporate scientifically validated exercises into strength and conditioning programs that they would start before the season starts. I don't have to give you a whole strength and conditioning program for your sport. I'll just tell you the exercises that work universally for essentially every sport. Ice hockey might be one that's off that list when it comes to, say, ACL prevention, because it's different, and downhill skiing is a little bit different that way too. But with those exceptions, if you incorporate, these are scientifically validated exercises. So lots of studies have been done showing that they work. You would have your athletes perform a validated warm-up before practices and games. Again, these things have been studied so often that researchers can't get funding to ask the question, do they work anymore? Because that question's been asked and answered. We know that they work. The next step is to implement them, to create an infrastructure, or to create a system or a culture where those things are habitually done by the athletes. Selection of proper equipment. And I'm going to plug you in and show you how to get information and access information about the best equipment used by the top sporting leagues. So this is on our website. It's a page that's on our website, ubortho.com. It's our practice plan's website, and I'm the president of the practice plan, so I can tell them what to put on the website. All we've done is gathered this information here. It's very hard to find otherwise, so we've consolidated it all. You got to kind of search around for it and find out what's valid and what isn't. So I'm going to show you the page on the website, and I'm sure I'm going to have to do a new share now. So let's make sure that that's working correctly. So, if you're not page, then I'm kind of flat out plain. But, hopefully everybody can see the web page and that this is working. So this is on our ubortho.com site. So it's ubortho.com. And if you go to a little button that says for patients, push that button and it will take you to this injury prevention page. And here's what it does. It just gathers together the information that I'm going to deliver in this talk. So you don't even need to remember anything for this talk or write anything down. It's being recorded so you can see it later if you need to. So you scroll down. These are the things that, here's what you have to do to have a state-of-the-art injury prevention program at any level. So you can access these things, and this is the same content that I'm going to give you in the talk. And then if you look further down, this is going to tell you about helmet performance that the NFL uses, because one of the things I do is work for the NFL. I have permission to publicize or to put on our website and to put into the public domain their biomechanical testing of football helmets. their biomechanical testing of shoe wear to use on artificial surfaces. From the NHL, we have permission to put on to this page and to publicize, put into the public domain, skate protectors and impact testing. If you want to, one of the things that happens in the NHL, a little bit of a digression, but in the NHL, people miss a lot of time because they get hit in the foot and the ankle with a slap shot. It really hurts, and they miss significant time because of that. The key thing there is that there are impact protectors that work for that. There's also this thing called the PEP program that was developed by Bert Mandelbaum, who is he's the head of the U.S. women's, he's the medical director for U.S. women's soccer. And they have a program that's designed to prevent ACL tears in soccer players. We have permission to put that on here, so this shows you how to do it. And then there's the warm-ups, which is the FIFA 11 Plus warm-up. And I'm going to tell you about that in a few minutes. And then there are some laceration protectors that are used in the NHL. So this is that content. It's the same content that I'm going to deliver in the talk. And I'm going to go back to the PowerPoint now, and then I'll let me reshare that. So 1 second. We'll do new share, and good. So that's back to that's the content that's in this talk. We'll talk about what injuries can be prevented. Concussions can be prevented, and I'll tell you how concussions can be prevented. ACL tears, hamstring strains, ankle sprains, foot sprains. There's a lot of other injuries that can be prevented. These are the ones that we have the best evidence on. One's your head, the other ones are lower extremities. I don't have great ways besides protective equipment to protect against upper extremity injuries. So it's basically head injuries and lower extremity injuries. How would you protect against concussion? There are some real things that you can do, and we have this information from the NFL and the way that things have been done. We also have epidemiologic data from college and high school levels. So really, to prevent concussion, be intentional and deliberate about your practice planning. Understand that if you're doing individual drills in practice, if you're just doing a regular, this is data from football, but it's true for a lot of other sports too. If you do individual drills in football, your chance of getting hurt during that practice period, let's call that 1x. So you've got a 1 chance of getting hurt with that. If you're scrimmaging, so now you're practicing against people on your own team. Everybody knows that that's not quite as competitive, but your chance of getting hurt if you're scrimmaging against people goes up to a 5x rate of injury. And if you're playing in games, your chance of getting hurt goes up to 10x. It's a 10 times rate versus doing individual practice activities. So that doesn't mean you should never scrimmage, and it certainly doesn't mean you should never play games, but you just need to know that that's a decision that you're making. So if you're trying to keep your players from getting hurt, you'd scrimmage as much as you need to, but you wouldn't scrimmage too much, whatever that is for your particular sport. There are drills too. So the Oklahoma drill, or what we used to call, I grew up in Minnesota, we called it the hamburger drill, where it's two guys line up, like linemen line up opposite one another, and they run and crash into each other. And typically there's a guy, a running back with a ball behind one of the guys and tries to, pass that line of scrimmage. If you're a football coach, you should stop doing that. People really don't do that anymore. It's a concussion machine. So realize that. And in the NFL, they educated the coaches about 11 on 11 practices. We'll do different levels of practice. 11 on 11 has the highest rate of concussion. So they recommended that they minimize 11 on 11. And then the other thing is helmet choice has an effect. So this is where we've linked you to the NFL's data. This is a poster. They biomechanically test all of the helmets that are available to be used in the NFL. And this is a poster. It's on our website. You now have a recording of it. We have permission to put this into the public domain. And this basically ranks how good the helmets are, from the worst performing to the best performing helmets. So if you're trying to use that information, you're trying to use that data as a parent, or if you're a coach or a trainer or an administrator or anything connected with your team, just give them that information. These ones at the top are the top performing helmets with respect to biomechanical testing. And there's lawyer language in there down at the bottom and saying that it's just for the NFL population and everything else. But the honest answer is, this is the only information that's available this way. So, use that as you need to. Lower extremity injuries can be prevented. Hamstring, ACL, ankle, foot injuries can be prevented. How do you do that? Practice planning, surface choice, and scrimmages. That 1x, 5x, 10x difference also holds true for lower extremity injuries. It's not just concussions. And the choice of surface that you play on affects injury rate. So if you're playing games or practicing on an artificial surface, artificial grass, artificial turf, your chance of having a lower extremity injury is 40 to 60% higher. That's known. That's validated in the best data. It's validated in the NFL. It's been shown in other studies as well. So just understand that. And I'm going to show you how you can do some things to hopefully mitigate against it with proper cleat wear. But the facts are right now that if you're playing on a synthetic surface, your chance of having a lower extremity injury is higher than if you're playing on natural grass. And I'll show you ways that you can incorporate that into your practice planning. Exercise programs. We don't have the ability to sort of show hands and things like that, and we won't do that now. But I'm going to assume that everybody would like to have their athletes doing an ACL prevention program. I don't know how many are doing it now. There were definitely some people that were respondents in the survey that are doing an ACL prevention program. But that's something that I'm going to assume that the athletic directors, the coaches would like to know as well. So we're going to show you the minimum things that you have to do for that. A warm-up. The FIFA 11 Plus is a soccer-specific warm-up. One of the things that our organization is doing, I'm going to show you a poster in a minute that's the FIFA 11 Plus warm-up. It's got a little bit of running, and it's got some strength and plyometrics, and it's got a little bit of running again. It's about a 20-minute warm-up that every field and court athlete should do as part of their warm-up. It's not the complete warm-up that you would do before, say, a soccer game or a basketball game or a football game, but this is the foundation of a warm-up that all the athletes should do, because it's scientifically validated and shown to decrease your athlete's chance of getting an ACL tear. So it's the most tested warm-up out there, and it works to cut down the ACL injury rate. So I'm not saying that this should be your only warm-up. You're all doing warm-ups, but this should be the warm-up that you use with your youth and all levels of athletes. Basically, we do these things with the Buffalo Bills. So that's another piece of this injury prevention. Shoes. I'm going to show you shoe wear in a second. The NFL has a cleat poster that's going to tell you what shoes your athletes should choose for an artificial surface to lessen the risk of a lower extremity injury. Here's the exercise program that would decrease the rate of hamstring, ACL, ankle, and foot injuries. This is on our webpage. It's the preseason exercise program. Basically, it's just a few things. There's a couple balance exercises. There's some hip abduction strength exercises and some other strength exercises. These are just YouTube videos that are found in the public domain that I just linked to. So if you want your athletes to lessen their chance of having a lower extremity injury and cut it by about 50%, approximately 6 weeks before the season starts, they would do these exercises about 3 days a week. They take about 10 to 15 minutes to do, and that can be part of any other strength and conditioning program as well. This is not the only thing that they have to do, but they should be doing these. They should be working on some of these hip abduction capacity, this specific strength exercises, and some balance exercises, and they work. It's simple and should be easy. You should just connect them to that content. Let me show you what an ACL tear to a injury, an experienced injury expert, I guess I'd have to call myself that. Let me show you what it looks like when it's prevented. So this is a Buffalo Bill. I'm going to show you some video that to me looks like he should tear his ACL. And the information's in the public domain, so there's no HIPAA violation. You can see who this guy is, but this video is taken from the public domain, and he came back and played that season. So you know he didn't have an ACL tear because that doesn't happen if they did. So here's the video. You're going to see with his right leg in just a second, step right there, and it goes out to the side. I watch lots of injury videos on these guys and have treated them for 20 plus seasons with 2 professional teams. One more time, I'll show it again. That is what an ACL tear looks like on video. So I watch this video and I say, shoot, there he just tore his ACL. But he didn't. And that might, if you're looking from the side, you actually see that he sort of overstrides a little bit, and he has what we call that varus moment to his knee when it sort of pops to the outside. That's exactly what it looks like when an ACL tear happens, but in his case, it didn't happen. And the only thing that I could assign that to would be the ACL prevention exercises that the Buffalo Bills do. So it can look like that. Here's the warm-up, and this is on our webpage, and it's in the public domain, the FIFA 11 Plus warm-up. It's got running exercises, strength and plyometrics and balance exercises, and some running exercises again. This should be the thing that is the beginning of the warm-up. You can also do team-specific drills and everything else. But whether you're a football or soccer or lacrosse or volleyball player or whatever, doing these exercises lessens your athlete's chance of getting an injury. It's the question's been asked and answered, and it works. Here's the shoe, the cleat pattern poster. And I just got the other day the 2019 cleat pattern poster. And it's got even more information in there. Basically, it's pretty easy to interpret. They'll give you a score for each of the cleat patterns. And the higher the score, the more that would lessen the chance of the cleat basically fastening to the artificial surface too tightly and causing the torsion to be brought up that thing we call the kinetic chain. And rather than friction being dissipated at the shoe surface interface, then it's the force is transmitted to the ankle or transmitted up to the knee. So if you're providing the best information to your parents and your players, you would show them this information, and they would choose the shoes that they use on their artificial surfaces accordingly. So how would you put all this together and come up with a state-of-the-art approach to safe, high-performance field and court athlete injury prevention? Everybody would do a lower extremity injury prevention program 6 weeks before the season starts, 3 to 4 days a week, which only takes 10 to 15 minutes per session, and it's on that webpage. Your team, so as a coach, you would become an expert in this FIFA 11 Plus warm-up program, and before every game in practice, you would have them do that warm-up, followed then by whatever you want to do for the performance of your team strategies, plays, that type of thing. But first, just have them do that warm-up, and you can appoint captains and teach the captains to lead it. Ideally, they do it on the surface that they're going to be playing their games on. So if they're going to be playing on a synthetic surface, they would do it on a synthetic surface, but they don't have to. If they're doing it on a court, they would do it on a court. The next thing you do, so if you do those first two things, it's 90% of the way there. And to me, that vision, make Western New York the safest place on the planet for athletes to participate in youth sports and in sports at all levels. If I'm driving around down in the South Towns, or I'm driving up around to the North Towns where I live, I'm driving up Millersport, and I look over towards the North Town Center across Millersport from UB, and I see a 15-year-old girls soccer team, 2 teams about to play each other, I'll know that we achieved the thing that we needed to achieve if I see them all doing the FIFA 11 warm-up plus or FIFA 11 plus warm-up before their game. That would be incredible. It would be an incredible vision, and it has to be delivered through the coaches, because the Western New York, no community has the finances to install an expert at every single team. The experts are the coaches. You're the experts. So become expert in that and give me less work to do. Those 2 things would be the major things. If you wanted to, and that's like the ice cream in the bowl of the sundae. And then you want to talk about like the sprinkles and the cherry on top. Give players and parents the information about helmets if they're playing football, and about shoe wear and cleat patterns if they're playing field sports, particularly on artificial turf. Football coaches eliminate the Oklahoma drill, so stop that. It's a concussion machine. And coaches should limit their scrimmages to only those absolutely necessary, and scrimmage on natural grass whenever possible. If those things happen, particularly the first two, but all of them, because I don't know what would be super hard about doing these things, then we would be the safest place, Western New York would be the safest place on the planet for people to participate in organized sports. That's that web page there, and then like I said, just push the button that says for patients, and it'll take you to an injury prevention tab, and we have all the info gathered there. And I've got one other thing, which I just think is a cool video, and it's sort of how to create a movement type video. So 1 second, and I'm going to navigate here for just a minute. We'll go back to like screen share. Let's see. So stretching myself to the realm of my technological abilities here. So you should be seeing this video, and I'm going to play this.
If you've learned a lot about leadership and making a movement, then let's watch a movement happen start to finish in under 3 minutes and dissect some lessons. First, of course, a leader needs the guts to stand alone and look ridiculous. But what he's doing is so simple, it's almost instructional. This is key. You must be easy to follow. Now here comes the first follower with a crucial role. He publicly shows everyone else how to follow. Notice how the leader embraces him as an equal. So it's not about the leader anymore. It's about them, plural. Notice how he's calling to his friends to join in. See, it takes guts to be a first follower. You stand out and you brave ridicule yourself. Being a first follower is an underappreciated form of leadership. The first follower transforms a lone nut into a leader. If the leader is the flint, the first follower is the spark that really makes the fire. Now here's the second follower. This is a turning point. It's proof the first has done well. Now it's not a lone nut and it's not two nuts. 3 is a crowd and a crowd is news. A movement must be public. Make sure outsiders see more than just the leader. Everyone needs to see the followers because new followers emulate followers, not the leader. Now here come 2 more people, then 3 more immediately. Now we've got momentum. This is the tipping point, and now we have a movement. As more people jump in, it's no longer risky. If they were on the fence before, there's no reason not to join in now. They won't stand out, they won't be ridiculed, and they will be part of the in crowd if they hurry. And over the next minute, you'll see the rest who prefer to stay part of the crowd, because eventually they'd be ridiculed for not joining. And ladies and gentlemen, that is how a movement is made. So let's recap what we've learned. If you are a version of the shirtless dancing guy, all alone, remember the importance of nurturing your first few followers as equals, making everything clearly about the movement, not you. Be public, be easy to follow. But the biggest lesson here, did you catch it? Leadership is overglorified. Yes, it started with the shirtless guy, and he'll get all the credit, but you saw what really happened. It was the first follower that transformed a lone nut into a leader. There's no movement without the first follower. See, we're told that we all need to be leaders, but that would be really ineffective. The best way to make a movement, if you really care, is to courageously follow and show others how to follow. When you find a lone nut doing something great, have the guts to be the first person to stand up and join in.
So I'm going to switch out of that again for a quick second. Bear with me. There we go. And that, I think that's a pretty powerful video. I certainly don't think that having your athletes do a preseason validated strength and conditioning program or the FIFA 11 plus warm-up before the practices and games is the crazy dancing guy, but that is what a movement looks like. And a movement looks like not everybody's, by definition, very few people are doing that at first. And then people jump on board, and you can see how quick you get to a tipping point, and we can get it there. I'm not a coach. You all are experts. One of the things that we've done as well is we've got some athletic trainers without organized sports going on right now who we've really given the responsibility for a couple things. One is to take that FIFA 11 plus poster, which shows some stuff before soccer, and to also make it a little football specific and basketball specific and volleyball specific. So those things are going to arrive on our website as well. And you'll be able to look and say, okay, here's the FIFA 11 plus warm up for basketball. And it'll just show how to do those things on a basketball court, or for lacrosse players with somebody carrying a lacrosse stick. The other thing is you all are the experts that will connect this information to the athletes, because that's what we need. We need a bridge between this information, which we in the scientific and medical sports medicine world know works, and the athletes actually doing that. So we've got a couple trainers, Dylan J. and Jeremy Plotchko, who are also going to be available. You can contact me, you can contact Allison or any of the organizers of this webinar, and we'll figure out together some way to turn that vision into a reality. So that's the end of the talk that I have, and I'm happy to answer any questions. Thank you.
Great. Thank you so much, Dr. Bisson. We've got a couple questions that have come through that either through email or through the site, so the chat room. The first one goes to, and we spoke a lot about ACL injuries and like you said, kind of lower leg injuries. There was a specific question on whether there's any specific guidance you can give to issues with Achilles tendons, and any resources or exercises you might be able to direct people to in regard to those type of issues.
Yeah, so there are two things that you're sort of dealing with when it comes to the Achilles tendon. If you go back to the basic science of Achilles tendons, first you have to get some degeneration in the tendon, and then it ruptures. There have been some studies that were done like years ago, even before I started in orthopedics, that show that really normal tendons don't rupture. If you take a ruptured tendon and you look at it underneath the microscope, you can see that it was undergoing some degeneration in the first place. If you're dealing with tendonitis, that's a problem that we take care of a lot in athletes. And there are some pretty simple exercises. There are things called eccentric exercises where you would stand on a stair, raise up on 2 toes, and then lower down on, or 2 feet, and then lower down on the affected side. And you do 3 sets of about 12 to 15 of those, and you do that 3 times a day. That's one of the eccentric exercise treatments we use for Achilles tendonitis. For other tendon problems, patellar tendonitis, quadriceps tendonitis, and to a degree Achilles, we'll use things called high force isometrics. We'll use those in the professional athletes, and it's pretty good for symptom control. In terms of lessening the risk of Achilles rupture, there is less scientific data on that, because the easiest diseases to study are the ones that are the most common. So ACL tears are far more common in field and court athletes than Achilles ruptures. So we don't have as good of data that shows that you can actually prevent an Achilles tear. But if you look at overall injury incidence in populations, definitely that stuff that I told you, the preseason strength exercises and balance, and the plyometric type exercises, and then the warm-up, the pregame and pre-practice warm-up work in terms of lowering the rate of injuries overall as well. So I can't give you a specific do this and you won't rupture your Achilles tendon, but I can say do those things, or have your athletes do those things, and they'll get hurt less.
Great, thank you. And just as a reminder to all of our attendees, if you go to the bottom of your screen and put your mouse down towards the bottom, the Q&A panel as well as the chat panel will come up, and you can type your question in either parts of those panel, and we will be sure to relay it up for discussion. So as we continue to gather those, the next question comes in about upper body injuries, especially as we start to see some in high school as with sports specialization. So any guidance on again, resources or direction of where to go to maybe address shoulder injuries or arm injuries resulting from the sports of swimming, baseball, were the ones that were brought up.
Yeah, then though, it sounds like maybe you're talking more now about like a reaction to the injury, which is my athlete's got this injury and now what do I do about it? Um, then obviously that's where our business comes in. That's one of the things that I do is then take care of people that have suffered or sustained the upper extremity injury. Um, the traumatic ones are pretty hard to prevent as far as we know, like a AC separation or a dislocated shoulder. Um, it's pretty tough to prevent those. In somebody that's had an unstable shoulder, we'll do some directed exercises for them, and we'll have them wear a certain type of harness that keeps them from getting in certain positions when they're playing the sport. But we certainly don't apply that to athletes overall. Um, if it's more of an overuse injury, then it's basically it's doing things like planning the training sessions, avoiding overuse, periodizing training, those type of things that the strength and conditioning people are really sort of expert in. We definitely see people that will have these overuse injuries, and by the time they get to my attention, a lot of times it is, well, let's dissect and break down your training program because probably somewhere you're overdoing it. That's what your body's telling you. Let's figure out a way to be a little bit more proactive about avoiding that. And often by the time they get to an orthopedic surgeon's attention, it's all right, we're going to have to back off on some training now. So if you can work with whoever is prescribing the training program and you're just kind of communicating openly and transparently with them, as you start to get some symptoms, a lot of times you make little adjustments and then you can back off. The problem is often when a calendar is imposed on your body, because your body doesn't have a calendar. My shoulder doesn't know what day it is or anything like that. It just knows the loads that it's been placed under, and it will do its thing and let me know that it doesn't like it if I overuse it. The other problem is that your musculoskeletal system typically has a delayed information system. It's not as rapid as we're used to. So if I do something that bothers my arthritic knee or something that causes my shoulder to act up, a lot of times it's not like it gives me a little beep or buzzer right that moment, but instead mails me a letter. And in the meantime, I've been living my life and maybe even doing some more things to it in the ensuing time period that I flared it up. But I get the letter a few days later and my knee is now like, hey, you did something that bothered me on Tuesday. And as a matter of fact, you also did it on Wednesday and Thursday. So I've kind of saved up a bunch of information to now dump in your lap.
Thank you, Dr. Sant. The next two questions come in regarding what we just learned this morning. So we know that the scholastic seasons, obviously, any hope of having any type of competition has been dashed in that regard, as it obviously should with the continuing health threat. But if we can see a continued postponement of seasons, if seasons are postponed, is the 6-week preseason plan something that you can continue on to do until the season is reopened? And any advice as to kind of this no man's land you might be in for a while, not necessarily having a specific start date?
Yeah, I think that's a great question. And I think I'm just, I look at every setback as a disguised opportunity somewhere. So, I think a lot of people look at things that way, that, well, this door's closed, but there's another one that's open somewhere else. The shorter answer is, yeah, it's absolutely fine to keep doing that. There's nothing, the 6 weeks that you start that preseason program that I showed there, that's the balance and some of the strengthening type things, that's a minimum. You can do that for 3 months. You can do that like year round, and that's even better. So no penalty for doing that. And as a matter of fact, I look at, I wouldn't be able to do this webinar at this time if my life were normal right now. I'd be seeing patients and, doing all my other jobs. But it's actually allowed us, this pause is allowing us to kind of get our arms around something that can be massively impactful and is giving us this opportunity to get good at that. So I would say if you're a coach right now and your season's being postponed, go deep into this FIFA 11 plus warm up. It's not, it's not super hard. Look at that poster and say, okay, well, let me at least train my athletes to do this. How can you all know your athletes. So how can I take this information and get my team to do this? shouldn't be super hard, and they're going to be a better team. They're going to be a healthier team when the season comes around. And the longer that they have to practice that, the better they get at it. So they'll just be machines doing, automatically doing this 10-minute, 3 days a week, little exercise thing. And then they'll also get good at doing that warm up. So I think it's an opportunity.
Great, thank you. And then as we mentioned, any other additional questions can come through the site. Any other thoughts for all the coaches and athletic trainers on the line about what we just might be walking into? There's a lot of uncertainty about whether sports camps are going to take place. All the different sports are going to look very different for the next 6 months. So if you were to leave the audience with just maybe 2 key takeaways as someone from that sports medicine profession of how to live in this unknown. We've talked about a lot of different things and a lot of great advice coming out. What are the 2 takeaways that you would want for every youth sport coach out there to be thinking of?
Well, our public health experts are going to lead us in terms of like the proper ways to avoid disease transmission. So that's one of the things, because obviously we have a pandemic going around that's highly contagious, and lots of people have caught this virus and are dying from it. The fatality rate isn't super high. It's well under 1% is what it looks like, but a lot of people are getting it. So you look at the scale of it, and lots of people are being affected, and we don't want to be responsible for, causing excess deaths or anything like that. Like that's a major, like the worst possible outcome that you can imagine. So stay abreast of things like the CDC's recommendations, but our public health authorities are going to lead us that way and show us the right way to start getting together a little bit more, and just sort of being aware of hand hygiene. I mean, my message would be the basic things. Wash your hands more than you think you need to and longer than you think you need to. Don't touch your face. Absolutely wash your hands before you eat. Wash your hands after you go in and out of your house. All of those different things, that's first and foremost. And then use this opportunity to give me less work to do in my orthopedic surgeon, sports medicine doctor business. And I'll be the happiest person ever if I see this going on and I see fewer patients in the office, because we can achieve that vision, and we have the time right now. If you need further information, or if you see, there's this information gap, or this actually execution gap, the information isn't being used, at least on a scale like a widespread fashion. So help me to understand how we can deliver that better and how we can do better. You're all the coaches that are involved with those athletes. So teach us, and we will do everything we can to provide the resources to make this happen, so that that vision that I'm talking about when somebody's driving around in the South Towns or driving past some fields and things is the real thing. It'll be the safest place on the planet for youth sports. We can do that.
Obviously some great information and great goals there to move forward to. Before I throw it back to Alicia to kind of serve for some closing comments, Alicia is going to come live here for a second, and we're going to do a push out where the webinar will be posted afterwards on our Project Play Western New York website. We are going to have our webinar available through and we're also going to have on our page our youth sports survey that is going on right now. So much of what Dr. Bisson talked about in terms of how we recover from this, we intend to put a lot of information out for all sorts of youth sports groups about how they can use this time to assess their risk and develop plans for their return. So Alicia, you want to share the screen with groups, and then as well as some last comments from you, Dr. Bisson. Okay, awkward moment. You're muted, AC.
Hi, okay, sorry about that. Hopefully you guys can see my screen with the resources page. And so on here, you're going to be able to find a variety of different resources for your family as well as for community. And our survey is right here where it says here for you. And with that, please, if you're a youth sports organization leader, this will help us really realize and help push forward whether it's going to be funding or what recovery will look like for Western New York and what you all need from us to provide that support for you. And then also below, it has our community resources out there that we are going to be adding to every single day. So if you find other resources that are not on here, please feel free to shoot us an email at projectplaywesternnewyyork@cfgb.org. Or you can also email us through our website and with any links to resources that you think would be valuable to everyone, as well as home play resources. We'll be continuing to put this up. And underneath community resources, we will be posting our webinar, and our webinar link will also be on our events page.
Okay, well, with that, I think that concludes the very first ever Project Play Western New York webinar. And so as a director, I just want to thank you. And I know that Alicia will have some final closing comments. Thank you for Dr. Bisson.
Thank you everyone for joining us, and thank you Dr. Bisson for sharing all of your wisdom and knowledge about what's going on right now and how we can all help our athletes return back to sports in due time. And one thing that we all just want to continue to harp on and discuss is other resources that are out there. So we saw in the chat, thank you, there's USA Baseball has information for arm maintenance and health of their players' shoulders. I know that can also tap into what volleyball players are going through right now and any other sports that are very dominate in your shoulder area and upper extremities as well as your lower extremities. So please feel free to continue to share amongst each other as well as with us, and anything else you guys want to see webinar wise, please feel free to shoot us over an email for that as well, and continue to visit our website and follow us on all of our social media sites and continue to share and add us for what you guys are doing at home, and be on the lookout for some great competitions that are coming out through our Facebook page, where you'll have the opportunity to possibly win some or receive some equipment from us that we have through various other youth sports organizations that just want to get equipment out continuously to all of the young athletes out there and all of the organizations that could use it during this time. So thank you all and have a wonderful weekend.
Thanks, everybody. I want to just say thanks to Alicia and to Bridget, and also to Nellie Drew at the UB School of Law at the Center of Excellence in Sport. And please let us know, let any of the people that you can communicate with that you have access to here, and they'll get it to me, if there's anything in your way in terms of implementing or installing any of this. And I'll do everything I can to remove those barriers so that we can get it done. I realize that it isn't going to be perfect at first. Nothing is. And all strategies are wrong at first, and then they have to be adapted, modified as you go forward. So let us know where things aren't working. And like I said, I'll do everything in my power to remove obstacles and provide the content and whatever infrastructure we can to make this happen.
Thank you.
Thank you again, Dr. Bisson and Allison Camp, and we look forward to working with you and hearing from the Western New York community.
Awesome. Thanks a lot. Have a great day. Stay safe, everybody.